Hello, everybody. This is Dr. Tejaswi, consultant neurologist at Onus Robotic Hospitals. So, today, welcome to the webinar on the topic of ketogenic diet and epilepsy. So, let me give you a brief idea that not always medicines are the only way to cure it, like our old generational knowledge comes from food. So, yes, there is a lot of science behind it, and I'm here to explain how the science of food and nutrition does help in some medical condition, which is one of the most serious medical condition like an epilepsy in terms of neurology. So, yes, the most fascinating intersection of neurology and nutrition is this ketogenic diet, where literally food becomes medicine. We understand how carefully diet is designed and how to control seizures. We try this medicine only when medical, that is, the drugs are not enough. And sometimes just to add on to the medicines and decrease the drug content or drug frequency, we do try this diet in epilepsy patients, especially in children who have resistant seizures or resistant epilepsy. So, what exactly is an epilepsy? It's an abnormal burst of electrical current in the brain circuit, leading to a motor and a sensory, probably sensory, a motor, and atonic effect in the body. So, that is called a seizure. And they're not always dramatic. Sometimes they can be very minor. They can be staring spells, especially in children, brief confusion, small jerks, which are usually missed, and sometimes it can be sensory, where only a part of your body will feel numb, or there will be burning or tingling sensations, which are actually sensory seizures. So, the challenge here is that almost one third of the patients do not fully respond to medications alone. So, here's where the alternatives or the add ons come into picture, and yes, diet is one of those easiest manipulated medicines that everyone has access to. And yes, why should we not go and take the help of those to add on to our medicines to get a seizure free life? So, yes, diet matters because everything, there's something called gut brain axis. So, everything that we put in our gut is recognized by our brain. And normally, the brain runs on glucose, that is sugar. So, when the sugar is restricted and fat intake is increased, that is nothing but keto, the keto part is increased, the body produces ketones. So ketones are a very premium grade fuel, which are very clean and neuron friendly, although it has to be very carefully calculated by a neurologist or a nutritionist. But let me give you a brief idea that it is neuron friendly if correctly calculated. So this reduces the brain tendency to have these abnormal sparks which cause a seizure. So yes, just by changing the brain's fuel, you can change how it responds. Exactly how simply, if you want to a metaphor, it's like being hungry. If you're having if you are hungry, then definitely you feel there's a mood change. So yes, by fueling your gut, you can control a lot of medical conditions as well. So what is ketogenic diet? It is a medically designed, high fat, very low carb diet. Almost 70 to 90% of it contains fat, and only 20 to 30 grams per day of carbohydrates, not 20 to 30%. So this pushes the body into creating a lot of ketones, and in a state where ketones are produced and an acidotic picture is produced in the body. So not Please make sure that this is not the very trendy diet and weight loss keto. It is different, and it is medically calculated by a neurologist or a specific nutritionist. Okay, so this has a scientific backing. So how does it reduce seizures? So ketones very much are a good fuel, so they stabilize the brain cells, hence preventing an abnormal short circuit in the brain. So they calm the hyperactive neurons. So in case you have a tendency of having a seizure, so sometimes even without a medication, just by ketogenic diet, this hyperactive neurons can be in control and prevent you from having a seizure. This is not like a treatment; it is like a preventive, more like a preventive method. So they make them fire less abnormally. The diet also helps restore a healthy balance between the neurotransmitters. The two neurotransmitters, the more common neurotransmitters, one is excitatory and one is inhibitory. So it maintains a balance between the two. That is nothing but more of inhibitory and less of excitatory. So it creates that balance so that this abnormal sparking will come into control and improve the brain cell function. Like every cell will have a powerhouse of transformer. That transformer in each and every cell of a body is a mitochondria. So this function is improved by this fuel. So that is how the overall ketogenic or ketones per se will improve the brain function, calms the brain, and helps improve the seizures. People who will benefit the most and who can we try this on is usually children with drug resistant epilepsy, because when it comes to children we cannot keep on adding an anti-epileptic without giving them a side effect. So because it's very important for kids to have this limitation, it is worth trying this diet in kids with drug resistant epilepsy. And yes, why not adults if there is a possibility? Then yes, adults also, but it's more tried in children. So, especially in conditions where the seizures are related to some genetic conditions where glucose transporter deficiency, there's a gene which is called GLUT1. So, there's a deficiency of this particular gene or deficiency of an enzyme which manages the sugar metabolism. So, people with that deficiency gene and a deficiency of that enzyme in the people, these people do present with seizures in a later period. So for these people, it is very important to go for ketogenic diet, because in this case, this may work wonders even without medications. So if one or two anti-seizure medicines have failed, in spite of a proper weight-based dose and proper compliance to medications, only then this becomes a very strong therapeutic option. So the types of ketogenic diet are there are multiple types of medical ketogenic diets. One is the classic keto, the most strict and most effective, but not always this is possible when it comes to children. So there are modified Atkins diet and MCT diet, where coconut and MCT oil to allow more food variety as well. And there's a low glycemic index treatment, which focuses on slow digesting carbs instead of restricting the carbs. So, based on the age, the lifestyle, the medical needs, we choose a variety of it, and within them also we individualize based on the patient needs. So, how does it look like? A typical looks like very rich in fats like ghee and butter, cream, cheese, nuts and oils, proteins like egg, paneer, fish, and chicken in a controlled manner, but carbohydrates are absolutely restricted, like no rice, no chapati, no sugary fruits, no sweets, and limited on fruits sometimes. And preferably more of vegetables like spinach, zucchini, broccoli. So every ingredient in a ketogenic diet should be measured and accurately calculated. So, is it safe? So, yes, if and when done under supervision of a perfect uh, consultant for that particular disease, whether it is epileptologist, a neurologist, or a medical nutritionist, when they are the one prescribing you this diet, then yes, it is very much safe, and it should not be tried. It should not be Google and tried at home. You should not mix this with the weight loss keto diets, which are very trendy on our social media. So it is required to monitor them, calculate them, and also monitor your medical conditions response to this diet as well before concluding it as a go. So yes, with the right team and right follow-ups, the diet is very safe and very effective. Like any medicine, even a paracetamol has side effects. So yes, it does have some side effects, but we think of giving it only when the risk is very low when compared to the benefits. So people may feel tired, children especially may feel tired and irritable, which we call a keto flow when they initially begin on it. But over a period of time, most of the people get managed and get accustomed to the symptoms and the diet. Long term, some people, because of the low fiber, they do have a constipation and some nutritional deficiencies, which should be what do you say, suspected and assessed and corrected or supplemented initially itself. So regular follow-up is very essential, like I said, and the monitoring of a kidney function and a liver function in general, even without a ketogenic diet for an epilepsy patient is very important. So we do it even much more accurately when it comes to patient with ketogenic diet and maintain a proper seizure and seizure free record and the exact diet that you have been followed, which will be guided to you once the physician or neurologist has been prescribing you this. So based on the response to patient, the diet may be recalibrated and recalculated. So once it is successfully, dealt with by both patient and the doctor, it does magical results. So yes, there are some impressive results real world wise. There are 40 to 60% of patients who have seen meaningful reduction in seizures, and small. There are some tiny percentage who have become seizure free as well. So yes, there have been some changes because of the nutritional deficiency, that is a vitamin deficiency and constipation. But once they have been identified early and corrected or supplemented otherwise, there is nothing to fear about in those cases as well. So the need for medicine, the side effect of the drug can be decreased by decreasing the medicine if we supplement the patient with a ketogenic diet. So summary and takeaway for everybody that the ketogenic diet is a powerful scientific therapy, not a trend, not the weight loss trend for sure. And it requires expert monitoring. That is something that you should take home today, which is very, very, very important because you just cannot Google it and try it by yourself, especially not in case of seizures. Food truly can become the medicine when used in the right way, and especially works for children with drug-resistant epilepsy and people with the deficiency of the particular gene responsive for the sugar digestion in the body. And yes, of course, everything can add up to the quality of living in a epilepsy patient. So thank you. A powerful evidence-based therapy for epilepsy. When done correctly, food becomes medicine. Thank you.